Hey there, this is Tracy, health coach and high energy girl. And today's workshop is going to be about the health crisis in the US. So in this workshop, we're going to talk about the current health crisis in our country, how it impacts you, and what you can do about it. First, a little disclaimer. These statements have not been evaluated by the Food and Drug Administration. This is not intended to diagnose, treat, cure, or prevent any disease. I am not a doctor or a dietitian. I am a health coach. So first, the health crisis in America. What is going on? Some great statistics. So in 1980, the U.S. ranked 11th in longevity, and today we're only 35th. Every 34 seconds, a person in the U.S. dies from heart disease. In your lifetime, a man has a 50-50 chance of getting diagnosed with some form of cancer, and the women's statistics are just a little lower. Americans have the poorest health in the industrial world, despite spending the most per capita on health care. 1/3 to 1/2 of the children today are expected to get type 2 diabetes in their lifetime. And many experts agree that degenerative disease is highly preventable. And by that we mean the heart disease, the cancers, the type 2 diabetes, those are degenerative diseases. According to the Center for Disease Control, heart disease was the leading cause of death in the United States. 1 in every 4 deaths is from heart disease. About 720,000 Americans have a heart attack each year. And the Framingham Heart Study, something I ran across in doing research for this webinar, it is the longest study on heart disease to date, and they have concluded that cholesterol does not cause heart disease. Yet, when you have cholesterol, your doctor gives you medication for that cholesterol. Why? Right? To protect yourself from heart disease. So I found that pretty interesting. I encourage you to do some research on the Framingham Heart Study. And according to the American Cancer Society, more than 1 million people get cancer each year in the US. Your chances of hearing a cancer diagnosis is 1 in 2 if you are a man, like I said earlier, and 1 in 3 if you are a woman. Only 5 to 10% of cancers are actually inherited via gene mutations. The rest, folks, are from lifestyle. Oh, there we go. The others are caused by environmental factors and lifestyle. And more than half of all cancer deaths could be prevented by making healthy choices. Now, the third disease we're going to talk about is obesity. Now, obesity may lead to heart disease, cancer, type 2 diabetes, stroke, high blood pressure, osteoarthritis, sleep apnea, asthma, gallbladder disease, and gout. And the last one we're going to talk about today is type 2 diabetes. This may lead to heart disease, stroke, nerve damage, kidney and eye damage, foot damage, which could lead to possible amputations, skin and mouth conditions, osteoporosis, and Alzheimer's and hearing impairment. Now, how does this impact you? Well, first, there's a huge impact to the cost of our country. And then second, we're going to talk about the patient impact. So heart disease costs the U.S. almost $109 billion a year. By 2013, it is estimated to reach $545 billion. The average heart attack patient's bill is $92,000 if you are lucky enough to live in California like me, or if you live in Arkansas, it will only cost you $3,334, and the other states are all somewhere in between there. Cancer cost the U.S. over $125 billion in the year 2011. It is projected to reach $158 billion in 2020. The average cancer patient's cost ranges from $6,000 to well over $100,000, depending on the type of cancer and the severity. And annual costs of obesity are $190.2 billion, $14 billion for childhood obesity, $19,000 for childhood obesity cost to the actual individual. Now remember, obesity was named a disease recently. I believe it was about a year ago that they actually declared obesity a disease. So health insurance issues. So we have the health issue, like what it costs the government, what it costs you, and now you think, okay, well, my health insurance covers it. So when we had the recent health reform, costs went up for many, okay, and the benefits went down for most. Do you actually know what happened with your policy? Have you really looked at the details to see what's going on? So my family policy went from $850 to $1,400 a month. So I went and I did my research. I was like, what is going on? That was a 60% increase. And my deductible went from $1,500 per person to $2,500 per person. So my copay is still $30, okay, just like it was before, but I have to pay the deductible first. That's crazy. We're a family of 5. I think I have to pay like the deductible for 3 people. And the 4th person, you don't have to pay. So how does this impact our future generations? What will happen to our children? Okay, you can see the trend here. It's not getting better. So this generation of our children today is expected to not live as long as their parents. Life expectancy fell in the US for the first time in many years. So what you can do about it. When you look into your future 5 years from now, if you keep doing what you are currently doing, living the way you're living, do you actually like what you see? What about 10 years from now? You know, does that future scare you, or are you heading in the right direction? I hope you're heading in the right direction. So what are your health goals? You know, do you have health goals, that things you'd like to take care of yourself better, or things you'd like to improve? What is one thing you can change this week? Okay, just one thing. We want to do slow incremental changes so that they last a lifetime. And how can I support you? As a health coach, that's my mission, is to go out and create healthier people. I want to teach people how to prevent disease so that they don't have the high cost of treatment. You can get free health tips at my website, but we'll get more into that later. Okay, heart disease risk factors. Now, with heart disease being the #1 killer in the US, we need to protect ourselves. So these are the things that go and create a high risk. Diabetes, being overweight or obese, having a poor diet, physical inactivity, excessive alcohol use. They say, many experts say that 1 drink a day is fine, but no more than that. Now with cancer, here's the risk factors. Smoking, infections. Okay, HPV is human papillomavirus, hepatitis B and C, Epstein-Barr, Helicobacter pylori. Okay, I don't know what that is, but it's an infection that helps or increases cancer risk. Radiation, so both ultraviolet from the sun and ionizing radiation from like x-rays, MRIs, things like that. Immunosuppressive medicines, a poor diet, excess alcohol, and physical activity, lack of. Okay, so look, the same type of factors that increase cancer, increase heart disease. Oh, and obesity. Now let's talk about environmental factors. Pollution, asbestos, those are things you breathe. Pesticides, things we breathe. And arsenic, which is found in a lot of water supply. Okay, so we want to protect ourselves from all of those. Type 2 diabetes risk factors, being overweight, having the fat distribution be in the belly rather than in the hips, you know, the big pot belly. Being inactive, having a family history of type 2 diabetes. Actually, race and age are an issue as well. Being pre-diabetic and having gestational diabetes. So when you're pregnant and you have that gestational, that increases your risk of type 2 diabetes later on. So let's start today. Okay, what can you do today? Lose weight if you need to. So let's get you on a healthy eating plan to help you shed some of those unwanted pounds. Eat whole foods. As Michael Pollan says, less wrappers and boxes and more leaves and peels. If your great-great-grandma doesn't know what it is, it's probably not food. Start exercising, okay? Just at the basics, walk. Walk 30 minutes a day. Break it up into 2 15-minute chunks if you need to. But Michael Roizen and Dr. Oz, both from the Cleveland Clinic, these 2 doctors are incredible, and they say to everyone, walk 30 minutes a day, every single day, rain or shine. Get out there and start moving. And being outside's better, you guys. There's some energy that you get from the ground and from the air and the environment that you just can't get on a treadmill. Drink more water. Drink at least half an ounce per pound of body weight. I tell my clients to get in a gallon. That's 4 liters. And one of my mentors, he has so much energy. Somebody said, gosh, his name's Brendan Burchard. I just absolutely adore that guy. And somebody says, gosh, Brendan, you have so much energy. Do you drink Red Bull? He's like, no, I drink water. 7 liters a day. I was like, whoa, that's a lot. But that's good. He's high energy. Okay, sleep, 7 to 9 hours a night. Most people don't realize that they will actually be more productive and get more done during the day if they give their bodies more rest. Okay, 7 to 9 hours a night. Rest and repair your body. Take high quality nutritional supplements. You know that I love Vima. I love drinking a liquid instead of swallowing pills. It makes me feel great, and it's easy for me to get in my body. Plus the mangosteen, that's something we'll go into later. But they're deprived. A lot of people are not, or most people do not get the nutrients they need from their food. And so they're lacking in, 1 or more vitamins and minerals. Mostly it's more than 1. De-stress. Okay, find a way that you can cope with stress that does not involve food. Maybe it's taking a bath. Maybe it's going for a walk, calling a friend, reading a book. There's so many different ways. Meditating. Let's get people so that they're not living in a stressful feeling, and create joy. Find stuff that lights you up. What do you look forward to? What are you passionate about? Finding joy in everyday life. Maybe you're doing the dishes, but do it with a smile. Play music in the background. I don't know what can help you get joy, but that's one of my missions, helping people find joy. So for more health and fitness tips so that I can help you go and create a healthier lifestyle, head on over to my blog and subscribe to my weekly newsletter. That's highenergygirl.com. Feel free to comment, ask questions, and share with friends and family. And I will see you with more health tips next week.